Hi, I'm Lou Bernardi from BrightPath, and thanks for joining me today. Today I'm going to spend 5 minutes to give you a sneak peek at what a 30-minute discovery call with BrightPath would look like, and why you should schedule it today, because it will start the course of changing the trajectory of the cost and quality of the healthcare your members are getting, and the cost for you to insure that risk. So first thing I need you to do is to think about your health insurance plan. It's either going to be a fully insured plan or self-insured plan. In any event, there's 4 basic components that determine your overall cost to insure that. It's your expected medical claims, your expected prescription claims, the admin, taxes and commissions, overrides, other hidden costs that you might be paying, and then your outlier claimants. These are your large claimants. And despite what most people think, large claimants are probably more of a reason to self-insure. If you explore that, you might find that the cost of your largest claimants can go down dramatically if you eliminate the 5 main components that really deteriorate health plans. What are they? It's the steerage of the healthcare system, big problem. Artificial discounts. The data has shown that your insurance company has been really, selling you a false narrative. There are no discounts. They do not get discounted fees anymore. They don't want to. And we'll talk about that. Rebates and spread pricing, excessive admin and fees, and then your outlier claimants. So let's talk for 2 seconds about the healthcare systems. Think about where you live. Wherever you are in the country, there's a good chance that you have health systems, not independent hospitals and practitioners anymore. Here in the New York metropolitan area, we have Northwell, we have NYU, we have Mount Sinai, we have the Catholic Charities, Maimonides, Montefiore, all of these health systems. There are very few independent hospitals because they can't operate, they can't exist unless they have something special or have the leverage to negotiate higher allowable rates from insurance companies. So back in the early 90s, health insurance or hospital systems had a big problem because the insurance companies did discount prices in the early years of managed care. So they were getting 50, 60, 70 cents on the dollar. Their shareholders and their investors didn't like that. So they got together and said, hey, we need leverage. We need to have something to be able to fight these managed care companies to get higher reimbursable rates. So they started joining forces. The largest health systems in the country have over 100 hospitals negotiating under one umbrella. Here in New York, we have systems that have a dozen, 20, and more than 30 hospital systems. But they didn't stop there. Think about where you are. The hospitals took over the facilities, the labs, the radiologists, the specialists, and ultimately those poor primary care doctors, the lowest hanging fruit on the totem pole. They took over the primary care doctors because they hadn't gotten raises in years. They had no leverage independently. There's thousands of them in the community. So who cares if you don't have the carrier contract? You had to take it or leave it. Most of them took it, but they were working really hard. So the health systems came to the primary care doctors knowing that they would lose money. These are loss leaders for the healthcare system, but they work them to the bone. The average primary care doctor sees about a patient every 7 minutes. Most of that time with the patients, you'll get this, you'll see their back because they're typing up the notes from your visit as it happens, half listening to you. That's why healthcare has diminished dramatically. We need to help the primary care doctors. That's a separate call. There's a lot of things that are happening in the healthcare realm where doctors are fighting back, and let's hope that they win that battle ultimately. So this is a big problem: steerage of the healthcare system. This primary care doctor, as I mentioned, was a loss leader, but on average they generate $1.2 million of upstream revenue for the healthcare system. That's a tremendous. These are the shepherds that are taking your members and sending them to where the care generates the most profit for the health system, not the highest quality care. Sorry to paint that picture, but that is the God's honest truth. So steerage is the number one thing. Whether you're fully insured, self-insured, you need to find a way to get your members to the best doctors. The best doctors prescribe appropriately, don't overperform unnecessary procedures, get less people hooked on opioids and other very intense medications, and they're just better for your community. They get your people back to work. The cost of care is lower if you can find the best doctor. We can help with that. Artificial discounts I talked about. We'll show you on a 30-minute call that your insurance company is overpaying for your care with your premium dollars and then increasing the claims unnecessarily, which results in higher and higher premiums every year. And I'm sure that you're experiencing that. Rebates and spread pricing, a huge Department of Justice investigation going on into the pharmacy benefit managers, which, by the way, are sister companies to the insurance. And that's another thing for another time. Excess admin fees, you need to make sure that you're collecting your compensation disclosures, that your partners in benefits are being truly honest with you in where every cent of their income is generated. And then your large claimants. Your large claimants are a huge opportunity. Oftentimes these are members that are on very costly specialty medications, otherwise healthy people on medications that are $20,000, $30,000 a month, and you're overpaying there by much more than 50%. You can reduce the cost of these people, which ultimately reduces your overall cost to insure. So let's get to a 30-minute phone call today. Thank you.